Hello, so we are going to be presenting on the 14 components of basic nursing care by Virginia Henderson. So who was Virginia Henderson? She was born in 1897 and she grew up in Virginia. She eventually became a nurse, of course, but as a child she attended a preparatory school in Virginia but never received her GED. So that led to lots of challenging situations in becoming a nurse. But eventually, her career began in World War I when she volunteered as a nurse's aide in a military hospital. And this opened the door for the opportunity for her to attend the Army School of Nursing in Washington, D.C. And obtain her degrees. She is accredited in developing many different fundamental teachings for the education of nurses. The first one I have listed, it is research. She did a lot of research in, specifically at Yale was a big time of her research career, but she used that time to research ways to modify nursing education to be more centered around the patient and their needs. And then she also, she did revisions to available materials for educating nurses, such as textbooks and just different materials available for them. And then lastly, what's listed is she developed the basic principles of nursing care, which is what our focus is in this presentation. A few of the names that she has been given over the span of time of her career was the First Lady of Nursing, or the Nightingale of modern nursing. And the focus of her career was really just to improve nursing practice through helping patients to achieve independence and meet their basic needs. These are just two quotes that I pulled from some resources such as The Nature of Nursing and another time where she was teaching. And the first one says, "The unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery, or to peaceful death. That he would perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible." That was said in 1955. And then the second one is, "The nurse is temporarily the consciousness of the unconscious, the love of life of the suicidal, the leg of the amputee, the eyes of the newly blind, a means of locomotion for the newborn, knowledge and confidence for the young mother, a voice for those too weak to speak," and so on. And that was said in 1964. And both of these really just show where her background came from, being a nurse's aide in the hospital, and her focus during her entire career of just refining the focus of nursing education. And this is a big timeline of many of her different accomplishments and awards, and it starts in 1921 and spans all the way down into 1955. And we see in 1921 was when she graduated from nursing school. In 1924, she became the first and only teacher at Norfolk Protestant Hospital School of Nursing. In 1934, she completed her master's degree. In 1939, she was asked to write a new edition for a textbook for nursing education by Macmillan Publishing Company. And then in 1953, she joined Yale School of Nursing as a research assistant to evaluate different studies that were being done on nursing education. And then in 1955, she published her very own textbook, which was the Textbook of Principles and Practice of Nursing. In 1960, the International Council of Nursing asked her to write one of her famous essays, the Basic Principles of Nursing Care. In 1972, she completed the Nursing Studies Index, which was a very big accomplishment in her career. In 1978, she published the Principles and Practice of Nursing, which is deemed her most important contribution to the nursing field. And in 1985, she received the Christian Raymond Prize from the International Council of Nursing. And then she also received honorary doctorates from Yale, Rush, and the Catholic University of America. And now Sarah Grace is going to come through and we're going to learn about the 14 basic components. There we go.
Okay, so before we get into the 14 components of basic nursing, it all starts with her nursing need theory. And so she defined nursing in such a way that it became internationally adopted as who we are as nurses. The nursing need theory really pushes the importance of patient independence. And she believed because of patient independence, they will continue to positively progress even after being released from the hospital. While it is the nurse's job to care for the patient, it is also crucial that we provide patient education so that way they're able to care for themselves after they leave our care and they can have some positive self-care progression out of the hospital. And so she described this role of the nurse in 3 different ways for the positive self-care, which is substitutive doing something for the patient, supplementary helping the patient to do something, or complementary working with the patient to do something. And because of these 3 different descriptions, these help the patient become as independent as possible. And as a nurse, we're able to aid in that. And so these descriptions led to her formulating the 14 components of basic nursing practice based on basic human needs. And so these 14 different points can include breathing normally, eat and drink adequately, eliminating body waste, move and maintain desirable postures, sleep and rest, select suitable clothes, dress and underdress, maintain body temperatures within normal range by adjusting clothing and modifying the environment, keep the body clean and well groomed and protect the integument, avoid dangers in the environment and avoid injuring others, communicate with others in expressing emotions, needs, fears, or opinions, worship according to one's faith, work in such a way that there is a sense of accomplishment, play or participate in various forms of recreation, learn, discover, or satisfy the curiosity that leads to the normal development, and help to use the available health facilities. And these are all broken up into 5 different categories like psychosocial, skin, all the good categories that we love to cover as nurses. And while it may seem obvious, it is so important that we remember these 14 components in our everyday practice because they're merely just a surface of what we do as nurses. And they should always be ensured. It's something that we should guarantee the patient. And it's easy to think that these apply just to patients, but they also can apply to us as nurses because it's so easy for us to feel burnt out and tired and just forget why we're doing what we're doing. But at the end of the day, we're human, and these are found on basic human needs. And so just as much as our patients need care, we need care also. So it's important to remember that we need to take care of ourselves as humans and fulfill our basic human needs. And if we're applying these not only to our nursing life, but our personal life, we can let these go hand in hand with our personal philosophy of nursing. And Kiara is going to talk a little more about that.
Alright, I will talk about the comparison to a personal philosophy of nursing that I had submitted a couple weeks ago. Starting off, Ms. Henderson describes the role of nurses in 3 terms, which is substitutive, supplementary, and complementary, which Sarah Grace explained earlier. And I will be giving examples of those and comparing it to that essay. An example of substitutive is including passing a call light to a patient in need, passing out medication when needed, and giving them food. The supplementary is helping the patient to and from the bathroom, moving them around the bed, and giving them bed baths when they cannot do it themselves. The complementary is changing ostomy bags with patient involvement. And I believe that these three roles support a claim stated in my personal philosophy of nursing, in which I describe the role of nursing as being focused on the protection, promotion, and optimization of health and human functioning through the belief of the American Nurse Association. Secondly, I talk about the nursing need theory and how it highlights basic human needs that provide evidence to the progression of sick individuals. As stated in the personal philosophy of nursing, a priority of nursing is the promotion of health. Henderson believed that patients' independency would increase if patients performed basic tasks unaided. And lastly, we talk about the definition of nursing, in which Henderson discussed and I discussed in the personal philosophy of nursing, which is the ability to provide care to those who are sick and well. Okay, there are many ways that Henderson's need theory can be applied in clinical situations, such as dealing with patients with cognitive impairments, decline in mobility, and patients that are post-surgery. It can also be applied while doing a comprehensive assessment on a patient to see if they lack in any areas of the 14 basic needs. And here I have a questionnaire to where we can apply Henderson's 14 concepts of basic needs with an NCLEX style question because we're in nursing school and why not? Okay, I have here a nurse is caring for a 70-year-old patient who has recently undergone hip replacement surgery. The patient expresses difficulty moving in bed and refuses to participate in physical therapy due to a fear of pain. According to Virginia Henderson's 14 components of basic nursing, which nursing intervention should the nurse prioritize to promote the patient's independence? I have answer choice A, which is encourage the patient to verbalize their fears and provide emotional support. I have B, which is assist the patient with repositioning and gradually introduce mobility exercises. I have C, administer pain medication only when the patient requests it. And I have D, allow the patient to remain in bed until they feel comfortable enough to move on their own. Molly, Sarah Grace, if you do not mind, may you help me and answer this question?
B. I say B too.
All right, the right answer is B, assist the patient with repositioning and gradually introduce mobility exercises. Henderson's model emphasizes helping patients gain independence in performing basic needs such as movement and maintaining a comfortable posture. By assisting with repositioning and introducing gradual mobility exercises, the nurse is supporting the patient's ability to regain function while addressing their fear of movement, which is also aiding in their development while in the nurse's care. And here we have our references so that you can check everything that we have provided in this slideshow. And I hope you all enjoyed what we taught you today about Virginia Henderson and her 14 concepts of human basic needs.